You're welcome. It's another day. We come up with another issue concerning the cautious lymphadenitis, or other known as the cheesy gland. So I'm disinfecting the area so as to eliminate or to reduce the microbial pathogen, and thus we want to prevent the transmission of diseases. So the purpose of disinfecting is that to eliminate certain bacteria during the procedure. I'm using disinfection agent. And after that, I'm preparing my local anesthesia, lignocaine. Okay, I'm preparing several cc there for injection of incision area or suspect area. So I'm preparing the patient for the medical procedure by injecting lignocaine. Then proceed injecting the whole site so as to relieve pain during procedure. Three things, crucial things, because we need to consider animal welfare during practice these daily procedures, because animal has feelings, so it's not advised to do this procedure without seizing the incision site. So the animal has all the right and the freedom to be caring during this little procedure that we pursue here. So the animal is called there. I'm already complete this issue of injecting ring, okay, to the area. Okay. Okay, I'm preparing my surgical bladder, the new one. I'm preparing the surgical blade there for incision. Okay, you're supposed to do the thing that you're supposed to focus is to make sure that you make incision underneath the area so as to during the procedure of removing the pus will be very easy, really, very meaningful. So I'm trying to squeeze it. So gently squeezing, squeeze. Oh, very bad. Squeeze. And proceeding make incision. Suspect area. Wow. So let's get something here. Concerning the diseases, we have got 2 3 tips here. Normally, the cautious lymphadenitis is a chronically contagious skin disease, and it is mostly caused by bacteria known as Corynebacterium pseudotuberculosis. And this disease is mostly categorized into 2 forms. The first form is external one, and the second form is the internal form. The external form is mostly characterized by abscess formation in the or near the major peripheral lymph nodes, and the internal form it consider occurring within the internal organ and lymph node. So the pus is normally occurring within the internal organ and lymph node. Although the both external and internal form of cautious lymphadenitis, or other name as cheese gland, it occur in sheep and goats. The external form is more commonly in goats, and the internal form is mostly occurring in sheep. Also, this is zoonotic diseases, so it is typically considered disease of sheep and goat, and sporadically it is occurring in cattle, horses, wild ruminant, swine, fallen people. So we can see how does this disease spread, or how does this disease transmitted. The bacteria, Corynebacterium tuberculosis, enter into the body through inhalation or penetrating of wetty or wounded skin, whereupon it is traveled to the nearest lymph node, and the sheep or goat gathering together presents the highest risk of a spread when infected. Sheep or goat calf or other things may be spread via soil contamination with the purse. And this issue, if the procedure are done and then there is no clearance in the site, this bacteria may be spread via the improper handling of those parts that are found within the get of this animal, within the house of that goat or sheep. Also, for the large farms, it is possible that contaminated of sharing equipment transmit any bacteria. Also, there are another way that this disease transmitted is by fighting, causing skin lesion in the head. So when the infected animal are fighting with an infected animal, there is contamination. So the bacteria may may enter to an infected animal and cause the spread of diseases. And another thing that we need to focus on these diseases it is the how to control this disease. There are many ways to control these diseases. First things is to eliminating the diseases or eliminating of diseasing calls the animal from the flocks. So the animal that's infected should be stay aside, and this is another way of control, eliminate it in the head. Another things to control this disease, we need to all the farmers should maintain the good hygiene during lambing, digging and the castration, docking and the castration, digging. Ensuring the good personal hygiene. There has been few cases in human where the lymph gland have been firmly fractured. So another thing is to clean and disinfect the clipper blade between the shaving treatment with antiseptic. And we need to another things to control is to observe the strict hygiene practices when dealing with suspect or confirmed cases. And we're just looking another way to control this disease is by eliminating those all animal who may be seen that are already affected with the disease in the flock. Also, there are another major things, a good way to control this disease is via using vaccination. So vaccination program is effective against these diseases. Also, another way to control this disease is to disinfect of sharing equipment within the herd, within the farm. Okay, and another thing is to focus on this disease in how to prevent it. Already see there how to prevent it. So we need to see how to prevent in another way. Another way how to prevent this disease, it is strictly biosecurity measures. Biosecurity measures mean that we not allow animal to move in a certain area so as to stop or to block the spread of disease to an infected animal. Other things to focus on these diseases is to treatment of these diseases. Treatment of these diseases. The potent antimicrobial agent should be used there. So as you can see, I'm preparing the drug for injection, the broad spectrum one, and this may be injected for 5 to 7 days consecutively via intramuscular. So I'm preparing my antibiotic for control the spread of disease within the animal system. And you allow to not miss any days after starting. So I'm preparing there my antimicrobial agent. Yes. Oh, yes, I'm preparing there. I'm injected intramuscular. Also, during injection, you're supposed to be careful because this is concerning the very sensitive nerves. Even if you get it or you touch it, it may cause a paralysis there. So, proper injection should be considered during. Wow, the animal should be feeling certain things in the body tasting. But all in all, I'm here for make sure that our animal is safe and free from this disease, the bacterium disease. Also, I'm preparing another one. I want to disinfect the area again, the incision area. Preparing there my medication. As you can see there, proceeding using it there. All incision site. All incision site. All incision site. I'm using there. I'm doing thoroughly palpation. Doing thoroughly palpation to all incision sites so as to ensure that all first are removing and the animal are free. Okay. Yes, I'm trying to squeeze in even if there is remaining of pus within the incision site, but I'm realizing that there is no any content coming outside. The cheese likes that is fractured. So I'm looking over. Okay, just completely thoroughly palpation area. Okay, just using wound spray so as to protect the area of eyes. The animal will be free from any external contaminant that may lead to affect this wound. So I'm spraying all the wound incision straight through. Yes. Yeah. Okay. I'm just check up the body. Wow. The procedure is went well, and the patient now is receiving something. Is feel free. I'm just trying to wave and I'm simple. There is no any things found there. So today our case end here, and we want to yeah, it's time for removing animal from restraining, and we are tightening rope from their hind leg. Yeah. Yes. So our case end here today, and Ferrari was going there. So the our case is ending here today. Thank you for watching. Subscribe and